Water1st is providing support to our local Bangladeshi partner organization, DSK, to implement water, sanitation, and hygiene education projects in the slums of Dhaka, Bangladesh. Our support is being provided to 3 slum areas in Demra, Kamranji Char, and Palabi slum. And today we're in Kamranji Char.
This is the case. We are working in urban slums, providing treatment, providing medical service. But without water, this is of no use. People are getting diarrheal disorders, and so they need clean water.
We're really proud of DSK for taking on projects in the slums. This is a really difficult environment to work in. These are complicated projects that are involving loans, but they've taken on this challenge because they're really committed to helping the hardcore poor that are living in these slum areas.
Our approach to provide loan or credit to people who want to install latrines or water points is based on our idea of self-reliance.
This water point here was just completed about 2 weeks ago. In 2006, through our support, they were able to put in about 21 water projects with the latrines that benefited about 1,600 people. And it's our hope that this year there will be another 40 to 50 water points constructed in those 3 slum areas.
We are on a delta plain. Every year we have to live with floods. That is our life. Many people loses their home because of flood. So they are coming to cities in search of employment, in search of livelihoods. In Dhaka city, 4 million people are living in urban slums and squatters.
We're in Demra slum in a cluster of households that we visited last September. And here we are just 5 months later, and big changes have happened in this area. The community has worked together to take out a loan, and with that loan they've constructed a new water point and also constructed a latrine. And what I remember from our previous visit was water was definitely a problem, but the need for sanitation was very great. They had constructed a latrine themselves, and it was in horrible shape. 20 families were using it. You can imagine the health hazard that existed with this old latrine, but we've seen the new facilities, and what a change.
The first step in this project was a community map. We came and sat with the community and drew a map of all the houses, roads, and factories that are here. They identified 4 specific problem areas: water, sanitation, drainage, and roads.
So what she is explaining that beforehand, when this tap was not here, they used to fetch water from the river and far away places. Now those days are not here, and now they are getting water from this tap. So next, the same group set to understand what are the types of diseases that is prevalent in this community. So that was done through the body mapping exercise, and number 1 disease came out as diarrhea.
This is another water point that's newly constructed. There's a well that's been drilled, and there's a pump in a pump house over here that pumps water up to this 500-liter reservoir so that they can have water 24 hours a day whenever they need it. They go into this area and can fill buckets. And there's also a shower for bathing so that they no longer have to use river water for anything. They can use this nice clean water all the time. So there are 4 million people that are living in slums in Dhaka. This is where a lot of them are getting their waters, from these filthy, polluted rivers like this. We just saw a water point that was constructed, 100 yards away, and it's just a couple days old. So 2 days ago, this is where they were coming to get their water. Now, thank goodness, at least for those families, they're able to access clean water.
People who live in slums, they are not living there by their own choice. They want to live a clean life. They want to have a better sanitation and water services in their place.
আমার নাম রেখা আমি যে
My name is Rika, and I live in Demra slum. Before we had this water point, we used to collect water from the river and the canals. The new water pump is so convenient. We are getting pure water, and my children do not have diarrhea like they did in the past. Our brothers and sisters from DSK came and helped us, and we are so much happier in this place.